What protocols to follow after getting the COVID-19 vaccine?
The first dose only seems to afford about 50% protection.
The difficult task of distributing vaccines fairly and equitably.
We have to be really honest, humble with the equity process across the board.
And the pandemic's added pressures on an already vulnerable population.
Right now, during this COVID, a shelter would be a death trap for me with my lung cancer.
Hello and welcome to Arizona 360. I'm Lorraine Rivera. Thanks for joining us. More than 700,000 doses of the COVID-19 vaccine have gone into the arms of Arizonans. That's about 10% of the state's population. And Arizona's top doctor acknowledges that number should be higher. About 60% of the state's supply has been distributed. ADHS Director Dr. Kara Chris says she wants to see it between 70 to 80%. But not all who qualify are having luck getting an appointment. It's an issue we'll explore, but first we got a better understanding of what it means once you do get a shot. Like trends nationwide, new cases of COVID-19 and hospitalizations are declining in Arizona. But the state is far from being in the clear, says Dr. Joe Gerald. He's the Associate Professor of Public Health Policy and Management at the U of A Mellon Enid Zuckerman College of Public Health.
Relatively speaking, we are still trailing everyone else. We're still in a crisis situation. Our hospitals are full. They're not as full as they were, but they're still very full. And so we have another 4 to 6 weeks to go before we're going to be in a much, much better place.
For those vaccinated, Gerald says they should still follow CDC guidelines around mask wearing, frequent hand washing, and social distancing.
Some of that is to model good behaviors because the general public doesn't know who and who hasn't been vaccinated. And there's still many, many Arizonans who are waiting in line and are still susceptible. The other thing is we don't exactly know how well the vaccine does at preventing infections. We know it's doing a great job at preventing severe infections, hospitalizations, and deaths. But that still leaves a little bit of question about whether people could become infected with a very mild case and still transmit to others.
As for whether those vaccinated should still get tested for COVID-19 if they don't feel well, the doctor says it depends.
I think certainly if you have only had one dose, then it's still possible that you could have COVID-19. The first dose only seems to afford about 50% protection. It's not until 2 weeks or more after the second dose in which the 95% efficacy still kicks in. So I think after that point, getting tested would not be necessary unless you're really symptomatic.
Where he sees gaps in distribution concerns who can receive the vaccine.
Those who are minorities, those who are in rural areas, they have been hit harder and have had less access to testing. And so I think it's a real concern that they may struggle to get their fair place in line for vaccination. And so it's something that needs continued attention.
For more insight on the issue of inequities surrounding distribution, we spoke with Dr. David Beta, Chair and Professor of the Department of Bioethics and Medical Humanism at the UA College of Medicine in Phoenix.
So the way I'm looking at this is if we take a three-legged stool and the stool is the vaccine program, if one of those legs fails, then the whole program fails. And so here's an example of each stool. One leg is the actual number of vaccine doses. The other leg is the distribution, equitable distribution. And the third is the prioritization of individuals who should get the vaccine. So right off the bat, we have a shortage of the vaccine. So that leg is not really sturdy. The distribution is not sturdy either because of the rural areas getting to the elderly, and the prioritization also is not sturdy because we've just had a change in the age from 75 to 65. So it's a revolving door, so to speak. So this three-legged stool is not sturdy at all. There's a lot of those legs that are just not sturdy enough to hold this vaccine program up.
What would be your recommendation about some simple fixes?
Well, unfortunately, the simple fix is getting more doses. And I don't, to be honest, I don't know how to do that other than to keep asking the government for more doses, which the state is doing. they're limited, their hands are tied by what's available to them.
I imagine this presents challenges for people like yourself in the field of medicine who know that you need to provide a service to people, you need to treat them, but there is not enough of a resource. So, what should people consider? I mean, there's growing frustration about the very ethics of all this.
The ethical quagmire of this whole aspect of the vaccine program is looking at the prioritization, who really should get the vaccines first, the argument as to who's more worthy than others, and this age issue. So, from the ethical perspective, one needs to keep in mind that I'll paraphrase from Dr. Zeus: a person is a person no matter what. And so everyone is worthy, regardless of whether you're a healthcare worker, whether you're an elderly, whether you have disabilities, et cetera. And so everyone has to kind of be treated equally. The healthcare workers, of course, are put at the top primarily because they're the ones who are going to engage in the treatment. So that doesn't make them more worthy, that makes them more important, so to speak. I'm not sure how to address that other than to say that we have to be really honest, humble with the equity process across the board. Consider, for example, the rural areas. Um, they're they're not getting as many vaccine doses as they need. What's happening with the Native Americans out there as well. So it is an issue. And how do you prioritize? That's a big issue.
As the virus evolves, as this new variant comes to be here, of course, in the state of Arizona, should the strategy of response be different? Are leaders, medical professionals having those conversations?
So I'm going to be fairly candid. The medical professionals are extremely concerned, myself included, with another surge with the variants that are coming to play. That there doesn't seem to be a sense of urgency outside the medical field that this is going to happen. We are concerned, and so even though we see the current numbers of COVID cases going down, the hospitalizations still are way at the top. If we begin to see a surge of the variants, we're going to find ourselves in trouble again. There are many medical professionals, societies, et cetera, that are sharing that with those who need to listen, and hoping that there'll be some adjustments. But I'm not sure it's going to happen.
So, for the public who are watching this and they think, I can't necessarily count on the state or federal government, what do I need to do in the meantime, given that this global pandemic continues?
Well, and unfortunately, we what we have is what we have. The unfortunate part is everyone needs to keep trying to get on the registration site and getting an appointment, hoping that within the next few weeks we'll get more doses and that the program will roll out to doctors' offices and pharmacies. What I will tell you is what we're seeing, not as much now as we were before, was jumping in line, is having individuals um, suggest that they fit the criteria when they don't. Now, there's no one can fault them for that. I mean, that's where they're really looking out for themselves and their loved ones, and that's what's happening. Is that morally or ethically wrong? Yeah, in the global sense it is, but when you look at it individually, maybe not so much. However, that's not happening very much anymore, and I think people are realizing that there has to be a sense of understanding and a moral foundation that we need to get those who fit the criteria vaccinated. Where we're hoping to go is that prioritization system will open up. Give us more doses, and it'll happen.
All right, Dr. David Beta from the U of A College of Medicine, thank you.
My pleasure. Thank you.
As Dr. Beta mentioned, adults 65 and up are eligible for the vaccine. They account for nearly 20% of Arizona's population, high risk because of their age, and in some cases, less tech savvy than younger generations. Seeing those barriers, the Pima Council on Aging is helping connect them to the right resources to schedule their shots. We learn more from President and CEO W. Mark Clark. We've heard anecdotal stories of people who are frustrated with the website. They can't get through on the phone call, and they're just wondering, is this system leaving me out of the mix because I'm older and I don't have the resources to log on or to sit on the phone all day?
Yeah, we certainly have heard that as well. Like I said, I don't know what your experience is, but my experience is that I hear somebody say what you just said, and then I turn around and somebody else says, "Well, I went on, logged on, and got an appointment for tomorrow." And other people are saying, "I've been in this technological queue thing," and I think, unfortunately, the response that I've heard when I've raised that issue with other officials is that people just need to keep trying.
How are you reaching out to the community to help them make this a little easier?
I mean, we have put a lot of energy into beefing up our website and are offering a number of our healthy living classes and programs virtually as well. But at the same time, we're aware that there is a significant digital divide in this community. Of course, I think when most people hear about the digital divide, they think about school children and homeschooling, but we have the same experience with older adults. And that whole issue of people not being very technologically fluent, if you will, people not having good broadband accessibility, and people not actually having the technology itself.
Overall, how would you rate the state's communication with the senior population here in Pima County, for example, when it comes to COVID-19 distribution?
Well, I'm not sure about the state's communication. I think the county is working very hard, as are we, to try to communicate as effectively as we can. I certainly know I've been doing a lot of interviews and have been talking with press, and I've certainly seen both Dr. Teresa Cullen, the Pima County Health Department Director, and Dr. Francisco Garcia, Pima County's Chief Medical Officer, in front of the camera a lot. I'm in meetings with them on a weekly basis, sometimes a couple of times a week, through the ethics committee and other initiatives. So there are there's a lot of those kind of conversations going on.
There may be older adults who are watching this interview and say, that has not been my experience. I don't quite have access to the resources that you're describing. What would be your message to them?
Well, I think there's a couple of things. They can call our helpline at 790-7262 for general information about resources in the community related to all things older adults, for those who are caring for older adults. And then the other resource is the county's helpline, which they've set up, which is 222-0119. That's 520-222-0119. We are certainly, and the county, and I think the state are attempting to create what I would call institutional supports for people. But the reality is, the situation we are in, there are 93,000 people 75 years of age who live in Pima County. There's another 120,000 people between the ages of 65 and 74. That's like 213,000 people in that older adult grouping, all of whom are identified as being at risk. We can't stand up, how do I say this, institutional supports for all of those people. And so we need to rely on friends and family and neighbors. And so I've been saying this really since March. People need to be neighborly. And so, how can you reach out? And maybe it's the person across the street, or somebody in your faith community that you might be able to assist in registering, for instance, for a vaccination program. Or maybe you're in a position where you might be able to drive somebody to an appointment.
I would imagine you're hearing from people who say, I can't leave my house or I can't log on to the website, but I need the vaccine per what we're reading with the CDC guidelines and recommendations. But it essentially leaves them in some sort of limbo because they don't have the right options available to them.
Well, the counties definitely is in a position to help people register. So with that county number, the 2221 or 0119 phone number, those operators are in the position to help people register. So That's an option for people who have no technology. I also understand the state has the state's 211 helpline is also helping people with registration.
Mark Clark from Pima Council on Aging, thank you.
Thank you, Lorraine.
The pandemic's health and financial impacts are especially difficult for those living in poverty, including people experiencing homelessness in Tucson. And as the crisis continues, more people are pushed into extremely dire circumstances. This week, we're hearing from volunteers doing what they can to help others. Known for hosting weddings, during the pandemic, downtown Tucson's Z Mansion is not the destination it once was, but it is still a destination nonetheless. One that caters 7 days a week to a clientele that comprises some of the city's most vulnerable, those without a home. For almost 20 years, the Z Mansion has served as headquarters for this type of support through the nonprofit Workship Project. Organizers estimate they have served more than 500,000 meals, averaging about 500 a week during the pandemic. On this night, volunteers prepped dozens of to-go style plates. At 18 years old, Shane Urbaniak is a seasoned cook in the kitchen who began volunteering here 5 years ago.
Well, before the pandemic started, this whole courtyard would be filled with tables. Everyone would be sitting family style. There'd be people going by asking if they needed anything.
Orange juice?
Excellent.
Now guests line up. Volunteers wear masks, face shields, and gloves. Those in the kitchen need a food handler's card, and speed is crucial to reduce potential exposure to the virus.
We get in there, we get it done, and we get everything cleaned up and shut down, and it doesn't even look like we were there by the time we're finished, which is really amazing if you think about it.
Workship also distributes clothing, blankets, and first aid, a vital service during the early stages of the pandemic. Last spring, tents went up in the mansion's driveway, where healthcare volunteers treated homeless COVID patients. Among the volunteers tonight, Sisters Kendall and Sierra Kalel. Pursuing degrees in education and nursing respectively, helping others is in their nature.
Some people, they'll see someone who's experiencing homelessness and, turn the other way, but whereas we try to do everything we can to, make a connection with you.
Very beautiful.
Oh, thank you. So my role, I would say, is just as someone who deeply cares and wants to know and ask how their day is.
Thank you.
For volunteers, the needs of others outweigh the risk to their own health.
Do you need a blanket?
Yes.
It comes out of just the fear is if I don't, then who will? These are people that need help, that need us, that need to be able to feel human again. I remember a couple weeks back, somebody talked to me that this is the only food that they get, period.
As volunteers wrap up meal service, Steve T. prepares to tuck in for the night in the same alley. He tells us he's battling lung cancer and he became homeless 6 months ago after losing his job.
But when you don't make a lot of money, it's real easy. Paycheck to paycheck, sleeping on a slab. You know why I call it the slab? Sleeping on a slab of concrete.
The struggles of getting enough to eat, finding a safe place to sleep, or even a clean restroom compounded by the coronavirus.
But what really gets me is the people walking around without these. The people that just don't believe this is real. I'm not going to a shelter. Right now, during this COVID, a shelter would be a death trap for me with my lung cancer.
Recognizing that hazard, City of Tucson officials say shelters have cut capacity by half based on guidance from the CDC. Concerns about an influx of high-risk people left without shelter prompted the city to launch a hotel program where those with COVID could recover safely in isolation. About $3.5 million in CARES Act funds have gone toward the program, which officials say they plan to keep operating for at least 3 more months, a move applauded by nonprofits like the Primavera Foundation.
We try to get rid of any kind of barriers or gaps to their becoming more stable. So that could be shelter services, it could be eviction prevention, it could be utility or emergency rent, it could be free mail and message service.
CEO Peggy Hutchison says Primavera serves several thousand people each year, and the need has grown, especially when it comes to helping people in danger of losing their homes.
So typically in a year, we might serve between 300 and 500 households with emergency rent assistance, eviction prevention, utility assistance. This past calendar year, we did over 2,500, and that was just our organization.
Recently, the CDC extended a federal moratorium on evictions through the end of March. The city has also put up nearly $3 million toward rental assistance and eviction prevention, and it has received $16 million from the feds that it hopes to start distributing next month. Much needed funding to address a pressing problem. But stakeholders say effectively tackling issues around poverty requires more. For Hutchison, that's collaboration between community groups and local government leaders.
You know, it's such a privilege to live here and work here and be a part of this community because we all pitch in. We're not trying to get more money than the other. It's like, how do we work together?
Compassion can also be priceless.
There's good people out there, and that's what keeps people like me going.
If you want to learn more about volunteering or donating to the Workship Project, visit their website, workship.org. You can also learn more about the Primavera Foundation services at primavera.org. The annual State of Education address from State Schools Chief Kathy Hoffman focused largely on the pandemic. She gave her speech this week to the State Senate Education Committee, telling its members that students are at the center of the crisis. She also applauded teachers for adapting and called on lawmakers to deliver more funding.
When the state sits on a $1 billion rainy day fund and projects a $2 billion surplus, there is no excuse to not fully fund every school.
We discuss the superintendent's hopes for this legislative session and factors that continue to keep students out of the classroom with Arizona Daily Star education reporter Danielle Camara. Danielle, what would you say was the headline out of Superintendent Hoffman's State of Education speech?
So I would say the main theme that ran throughout her address was, as she put it, that the state continues to deny funding for public education. So one of the main ways that the state is not fully funding public education is because remote learners are not being funded at the same level as in-person learners. So this is an issue that is affecting public schools throughout the state, and schools could stand to lose as much as $500 million if remote learners are not funded at the same level as in-person students.
As legislators move into this session, what is she tasking them with or asking them to do, given that Prop 208 monies essentially remain in limbo at this point? What sort of funding mechanisms will she be looking for?
Yeah, so there's a few things. One is she led with this at the top of her address, was to fully fund remote learning, as I was just talking about. And another thing that she's asking for is additional funds for resources to help with the social emotional well-being of students and teachers. So she's pushing for an extra $43 million for this state's school safety grant program, which would more than double the current funding. And she said that that would add 355 counselors or social workers to schools throughout the state.
And that being said, there's this vaccine rollout that is targeted toward teachers to get them back in the classroom sooner. What's the reality, though? How easy has that process been so far?
Yeah, so I can talk about how that's been going in Tucson, especially since I've been following that. And I'll tell you, Lorraine, it has been one of the most confusing things that I've had to report on. So far in Tucson, as of the end of last week, we had vaccinated about 7,000 K-12 staff. Now, that was just the first shot, so they all need to get their second shot still. Dr. Francisco Garcia with the county health department said that they anticipated getting another 7,000 K-12 staff and educators vaccinated this week. If that happens, that will be about 2/3 that have their first shot. But the rollout has been slower than anticipated. It's been a little confusing. The instructions that the county health department gave in the beginning have changed several times. So I get educators. I'm very connected to the educators in the Tucson community. And so I hear from them all the time saying, I don't know how I'm supposed to make an appointment. I don't know who I'm supposed to call. And that is becoming more clear. It was a little confusing the first couple of weeks, but it seems like it's starting to smooth out.
You talk to teachers, families, unions, school leadership. Does anyone actually expect that school will return in the state of Arizona to the traditional in-person learning environment this semester?
No, I do not think so. Not traditional in-person learning. I think that many school districts are hoping that they can at least have some type of hybrid going by the last quarter of this school year. And it seems like most school districts are really hoping that they can start traditional school at the beginning of next school year, and that would be basically in the beginning of August.
All right. Are there other roadblocks that you're learning about through your reporting with a hybrid online in-person instruction? I mean, is staffing an issue?
Yes, staffing is one of the greatest kind of roadblocks to returning to in-person learning. And that's because not only from teachers and staff getting coronavirus, but also because of all the people that end up having to quarantine. So there have been school districts that, while they're just doing hybrid in-person learning, have had more than 100 staff members quarantining on the same day. And I think it's important to keep in mind that transmission in schools is pretty low. So it doesn't mean that all these staff are getting coronavirus in school or that they even all have coronavirus. Many of them just have to quarantine because they've been in close contact. But with so many people in the community catching the virus, there ends up being a lot of staff out quarantining at one time. And then to make matters more complicated, there are not enough substitutes to fill in. And so that really has been probably one of the greatest roadblocks, other than concerns over public health, to returning to in-person learning.
Yeah, regardless of how this unfolds, you still need a qualified person in front of the children, whether it's in person or online.
Exactly. Not to mention driving the school bus, janitors, all types of positions throughout the school. People end up having to quarantine, and so there's not enough people to run a school sometimes.
All right, Danielle Camara, education reporter from the Arizona Daily Star. Thank you.
Thank you so much for having me.
That's all for now. Thanks for joining us. To get in touch, visit us on social media or send an email to Arizona360@azpm.org and let us know what you think. We'll see you next week.